ABG. Now, they might be asking you for ABG as well. The scenario might be like a patient is 50 and has been admitted because of COPD. You talk to the patient and do the ABG sampling. The scenario is straight away just go and do ABG. So what you do is when you're doing the ABG, if patient is here for COPD, you can ask a couple of questions about COPD as well. When was he admitted, which symptoms he had, how he's feeling now, if he's taking his inhaler properly and all. Just a couple of questions just to have a understanding and building the rapport, not going into much of detailing. The task is very clear that you have been told to go in and do the ABG sample. Just go and do it, then not a problem, right? So make sure you gather all the instruments and all. Now, before you do ABG, you have to ask few questions. There are some contraindication maybe where you may not be able to go for ABG sample. The thing is, if, for example, if patient has got fistula in one of the arm, will you be going for ABG? Not really. And if, for example, you have planned a fistula, we're going to do a fistula in this arm. So make sure you don't get the sample from this arm, right? That's the main thing. If patient is having fistula or we have got fistula planned for next couple of days or so. So make sure you don't do ABG sampling in that arm. That's the main thing that you need to ask to this patient in the beginning itself. Okay. And you can also ask if the patient had any trauma or so in this arm. So you will try not to do in that arm. Otherwise, if everything is okay, maybe you can do it in any arm, but preferably maybe I will do it in the non-dominant arm, which is much better, right? So gather all the instruments and all. And before you go for the sampling, you need to do one more thing as well. You need to do modified Allen test. So now I don't know what kind of mannequins they are going to give it to you. So there might be a mannequin which is electrical mannequin. So if you check the videos on the YouTube, you will see we have used that mannequin and you can do the modified Allen test in the mannequin itself. Or not, if not, you can demonstrate it and show it to the patient and to the examiner as well. So how modified Allen test is done. So see, you have got your radial artery, you have got your ulnar artery as well. The only aim is because when we do ABG sample, we get the blood from the radial artery. So if something happens, in a very simple language, if I have to say, if something happens to the radial artery and it's not supplying your hand, can ulnar artery take care of your hand's blood supply? That is the thing that we are trying to check in modified Allen test. How you do it? So you actually use your both the fingers and you put the pressure on the radial and ulnar artery and you make a fist. So when you put the pressure, what's going to happen? You're not letting this blood go in the hand. So when you do that, say, for example, say 30 seconds, what's going to happen? After 30 seconds, for example, if I open my hand, it should be blanched. Now leave the pressure from the ulnar artery, still keep the pressure in the radial one and leave the pressure from the ulnar artery. Within 7 seconds, if you see the blanched hand has become red, the blood supply has come back. What does it mean? It means the collaterals are working. It means the ulnar artery is enough to look after your hand. It means you can go ahead and do your ABG. That's how you will demonstrate your modified Allen test. Right, so that's what you have to do here. Do we need any tourniquet in ABG? The thing is, no. It is the ABG syringe. It's going to fill on its own because you have got the pulsation. Because of that, you will see it's going to fill completely. So you don't need to worry about that. Right, and when you get the sample, what we have to do is in other blood sampling and all, we usually say, I'll send this blood sample for this investigation. But when it comes to ABG, you will say, I will take this sample myself to the ABG machine and I'll get the results. I will do that. Mainly you will see the ABG machines are there where usually you'll find in A&E, you'll find in ICU as well. Mostly you'll find in the respiratory units as well, right? So that's the main thing. So I'll take this sample myself to the ABG machine and I'll get the results. And if, for example, if somebody asks you that ABG machine is not working and you found out that it's not working, so I'll take the sample to the other ward, I mean to the ICU or to the A&E. Or else what I can do, I can keep this sample in the ice box as well for some time. I don't want to waste this sample. If the patient is on any oxygen, make sure you note down that as well, because the machine, when you put the things in the machine might ask you that as well. And once I get the report, I'm going to put it in the patient's file. I will document it. So that is how you will do this sample. All right.